I'm just going to go ahead and probably start with answering all of or most of your first question, which is, what on earth is an ethicist and what does this have anything to do with advanced care planning? You are not alone. I can guarantee that. If you do not know what an ethicist is, part of my day is explaining a bit about what we do. But thanks to Chloe, oh, there you are, for highlighting a bit of perhaps what it is we do. So just to take a step back, what do we talk about? What do we mean when we talk about ethics? Ethics is really about having thoughtful, careful, and systematic examination of the values and beliefs that underpin our attitudes, our decisions, and our actions. So it's really about asking the question around, that reflective practice in every day, our own personal lives, but also professionally. The question around, what should we do in this particular situation and why? And that's very much grounded in the values that we hold. And this is particularly important to ask those more reflective questions and consider what is the ethical, the right, the best thing to do, all things considered in this particular situation. Because we're often faced with values conflict or values tension, in particular in healthcare settings that we see. Ethical dilemmas arise when we're faced with situations where different parties have divergent values, differing values of what I believe to be the good, the right thing in a given situation. That leads to opposing viewpoints on what might be the most appropriate course of action, or in some case, inaction. It also can arise when we might have, and we certainly see this in healthcare quite a bit, certain constraints on what we know is the right, the best fitting thing to do, but we're being prevented from doing it. We're constrained from moving forward with that plan of care in alignment with the values we seek to uphold. And that could be due to resource constraints, legal constraints, and otherwise. Mm-hmm. Ethical dilemmas can also occur when we see tensions in our own roles or our own duties. I might have multiple responsibilities, again, whether it's my daily life or professionally, and I'm trying to uphold various values that I know to be good. I want to respect someone's autonomy, their right to self-determine how they choose to live their life, but I also have a duty to ensure their safety, their well-being, and promote goodness and overall health and quality of life. But I might be faced with a situation, a choice around not being able to uphold both values at the same time, or duties or roles. And so we need to make a considered decision around what approach am I going to take, what action, what decision, and why. Again, asking ourselves that reflective question. Herein comes the role of an ethicist and what it is we're really seeking to do. So at VCH, at least, and many other health authorities, if you're visiting from elsewhere, have staff ethicists or perhaps an ethics committee that work in our health authorities in BC and in many other provinces. And the one at VCH, I'm the first on-call ethicist for all of our coastal community of care, so including our Sunshine Coast. If you're looking for an ethicist, I'd be first on call, but also I have Kirsty Russell here in our audience, if you want to speak with either of us afterwards, who also supports these areas for all VCH, whether it's owned, operated, or supported sites. And our mission of our ethics service is really to help cultivate and support a culture and practice of ethical responsibility and accountability throughout all of the VCH services. And the ways in which we aim to achieve that lofty goal is through these three primary functions, largely through education. So opportunities such as this to talk with public on ethics-related matters, but also we do a lot of staff in services, like we actually have the opportunity to do today at the hospital on ethics, various ethics topics, with staff, medical staff, as well as leaders. We also inform the development or refinement of policies or guidelines that might have an ethical component. So for example, things like when MAID was first legislated, so medical assistance in dying, we were part of a multidisciplinary working group to help develop what would that look like in practice what is a fair approach and, from an ethics lens, that ought to look like. And the main function of our role is really to provide and offer ethics consultation. So what Chloe was just mentioning about when we're faced with those different scenarios that is causing some sort of ethical dilemma and we're uncertain, what way is the best way forward? We can help support both the teams or an individual clinician, but also patients, families, and their loved ones who are being supported in a VCH service, who are also facing ethical issues or some moral distress that is lingering where we're feeling constrained and feeling that there's a values conflict or some uncertainty and we just don't know where to go. So our role is very much a supportive one. We are not the ethics police that comes in and says, you must do this, you must do that. We're really here to support the decision-making process and offering a more systematic and considered way of, have we asked all the questions? Have we looked through all of the parties who've been consulted or involved? Are we getting the right decision maker around the table to actually make the decision? But at the end of the day, it is the person, whoever is accountable and responsible to make the decision. It's their choice. And we're just there to help support them through that if needed. And these services, of course, are free and confidential. And every year we track and look, what are the most common themes and issues and topics that come up as questions and issues to, at least that we know, in our consultation service. And advanced care planning, perhaps not surprisingly from what has been shared today, has very commonly been reported as one of the key issues. In the previous year, we just did our fiscal year kind of overview of our service. We had about 40 case consults on the topic of advanced care planning. And these were the 4 themes that related to the topic of advanced care planning. So issues that coincided with that were largely around end of life, when there was disagreement between the care team and the family, and or within the family, there was discord on what is that best way forward for my loved one who cannot speak for themselves. When there may be, again, that uncertainty or disagreement when there's been a request for care considered to be clinically non-beneficial, but the family feel perhaps very differently. And the issues around substitute decision-making. So again, the cases that Chloe raised as fictional are very much ones that resonate with me as well, because those are the issues that we get consulted on very regularly. So when thinking back to those examples, some of the questions and issues that we might get brought in seem very similar to, Robert and June's case, where we're asking, we have that ethical uncertainty over whether the choices being made by their temporary substitute decision makers were really in the person's best interest. Perhaps, especially if we find out more information along the way, perhaps with Robert, his friends come in and say, absolutely not. This is completely counter to how he's always spoken about what he would want. And then we might be struggling with, well, what is best for Robert if he can't speak for himself? Where do we go and who is the most appropriate decision maker? What is the process we need to go through? So often teams will kind of bring us in and try to weigh that up. And similarly for June's case, if we do have insight into sort of how she made decisions and what her values were that seem to conflict with what her spouse is refusing in her case. And for Mina's case, that is another one that often comes up when we have 3 adult children, all who are under the temporary substitute decision-making hierarchy, as was very nicely spelled out for us earlier. They all have equal decisional authority if we're not appointing someone. And so if they disagree, as others have pointed out, not all families get along or share the same values and perspectives and worldviews. And that can create some conflict in amongst the family around, what to do for Mina and for her, placement down the road, or as her dementia advances and things change for her. So again, it's sort of that, where do we go and what is best? Because what we know from advanced care planning, when we do engage in it, is that we are really the goal is really trying to, in ethics terms, uphold these 2 key values: respect the dignity and self-determination of individuals and promote their well-being and reduce harms. And studies have shown that when given the choice to express a wish and know what we'd want. More often than not always, but most often, we do choose less aggressive interventions, and we have a greater preference for palliative care, as was mentioned earlier. The default otherwise would be full intervention unless not clinically indicated. So what we know, again, is when we have these conversations and we make plans, that is the opposite of what we might actually want, which leads to often fewer acute hospitalizations. And furthermore, and I think this has already been stated, but research also shows that when we engage in advanced care planning, it really does increase the quality of our end-of-life experience when patients are surveyed, and decreases, as certainly others have mentioned, the burden on the caregivers and family to have, their own moral distress reduced, to know, I know, at least as difficult as that decision was to make, I know that it was in line with what they would have wanted, and I can rest assured. When studies have looked at, what does it look like when we're measuring advanced care planning, what are the 5 indicators of success? I won't name them all, but these are, at least again, the research, shown to be the 5 most common signs we're looking for to see, like, are we doing this? How are we doing? Are we doing it well? But really, ultimately, it's about that number 5 indicator. It's about ensuring that we're aligning the care provided with what the person's goals and wishes are to the greatest extent possible, whenever possible. And when research has been done on advanced care planning outcomes, we know that that is most often going to be achieved when patients engage with both family and healthcare providers and in care planning and communicating those choices. But there's been, and this is a little bit more dated research, so I'll have to look to see if there's been more pan-Canadian studies on this topic, but when we do assess how well in Canada overall is measuring up on meeting these key goals, there's certainly a lot of room for improvement. Luckily, though, there is some good news, and especially more recent research that has been done through the Advanced Care Planning Canada report. You can find the full report. It's really wonderful, insightful report online. But what we're seeing, especially since COVID, is there has been a huge increase of folks actually engaging and educating ourselves on advanced care planning, both the value and how to do it well, and being supported through forums such as today. And sounds like many other local community events, like on the Green Sleep program, which is excellent. So we're having these conversations more. We see that increase with at least family and close friends. We're seeing some work still to be done, as the numbers are still, while it's increasing, still quite low with healthcare providers, and even lower and dropping, it looks like, with engaging in conversation with our financial advisors and lawyer professionals. So while that's encouraging for sure that we're having more conversations and becoming educated, especially with our loved ones, about what we would want for ourselves if we could not choose, ensuring we have these conversations on an ongoing basis. So it's not a one and done, it's over time as things change, as my condition changes, as new information comes in about what my options might be, and engaging all parties, including, and this is my soapbox point, with our healthcare teams. The onus is not just on you, the patient, to be thinking and talking, but also healthcare to be able, as Dr. Guja had really mentioned, learning. And learning requires that conversation and understanding, that shared decision-making alongside our healthcare professionals, to know what options are even on the table for us. And having a good understanding of the tools, like what Carmen also mentioned, lawyer Carmen, sorry, around all the different tools available to us to put those wishes down, and documenting is critical to ensure that, those goal concordant care received is in alignment with the goals and wishes, and when the time comes can be actualized. That's critical. But we know, and I personally know, I just had this personal experience in my own family in the few months back. These are extremely difficult conversations to be had. And it's easy to say we should do this, we know the benefits, but the actual getting down and doing of and having these really heartfelt, difficult conversations. Thank you. Is that an alarm? Okay. Is extremely challenging. So knowing that you're not alone, there are tools, there are professionals out there to help support the conversation. So really encouraging, again, just flagging for the resource fair that follows this session. Great resources available around how do I start this conversation with my loved ones? What are the kind of questions I should be asking? So whether it's the green sleeve or the what matters most to me document, there are some things there. And of course, broaching the subject if you're willing, if you're ready, with your healthcare provider and having that informed discussion to ensure that we can really honor choices and make a plan that is, really individualized to your personal situation. And as I think Chloe noted earlier, we know that advanced care planning, even with the best well-laid plans, cannot account for every situation down the road. And certainly ethical issues will persist because there'll always be some level of uncertainty or perhaps changes in technologies over time that we may have missed and not thought of or known of. But again, there are resources and tools out there when we are faced with uncertainty, with discord of views, including things like ethics services. And this is our decision tool that we use to help guide our decision making that we will explore with you or with your loved ones when we're trying to contemplate and weigh up what might be some options. And the first step, one of the first questions we ask is, do they have an advanced care plan? What does it look like? If not, then what? And go through. So we're here for you, and do feel free to reach out. I'll leave this up for a minute if anyone takes a screenshot. Otherwise, I'll pass that on to Jane. Thanks again.